So let me loosen up my bra strap and let me boost you with my raw rap.
Hello, it's your girl Ms.Carlababy, and welcome to my house, sweet babies. I was just doing a quick video about my health, about HS, Hidradenitis, Suppurativa, along with other health issues that I have. I haven't did a video like this in a while, but I want to be thorough with my update and, well, kind of be thorough because I am in a lot of pain right now and I need to go lay down because I just did a quick mukbang for you. But I like to go over some things. And first of all, before I get this started, I would like to tell y'all, please go check out, I try to look for people that's in some sort of situation like I'm in, and this person is going through and has been through the things that I've been through. Everything he's going through right now is the things I'm going through right now, and my condition is a little different because I have tumors with mine also, but it's the same thing when it comes to our diseases and the same thing that's happening to him. All the antibiotics at home, the pain meds and all that. I've been through all that and I'm going through all of that. Like I said, this disease can be gravely ill. I'm talking about the HS. It can be gravely ill, and mine is gravely, and his is gravely also. You check his pages out. His name is J Cutis. That's JAYQUDDOUS or something like that. I'm gonna have it somewhere on the screen. I have both of those pages. The other ones is Cutis Vlogs. He has 2 pages. Check those out, please, because I'm not as brave as he is. I showed one of my wounds one time, but that's all. It's an embarrassing disease. He's one of my heroes because he is so brave. He's a young guy, and he is coming out to the world with this to help others. He's not getting paid for any of this. He's getting nothing. He does this out the kindness of his heart, and I can't believe it. Like, he has tears going through my eyes, and also I'm in pain watching it because I'm going through the same thing as I'm watching it. So it gets emotional because I feel for other people, but they're going through the same exact thing I'm going through, you know. But when you see other people go through it, then you see how bad your case is, you know. Even though I know I'm bad, it gets worse when you see other people going through, because I don't see that every day. I haven't seen anybody in person go through what I go through. So it's hard to look at other people like on YouTube. YouTube is the best thing because you have so many people that's coming out with different things, you know what I'm saying, that helps others. And that's what it's all about, is helping other people. Like I said, I don't get paid for none of this either, and I don't want to be paid, you know, because I never know when this could be over right when I get off now, or right now it could be over. I'm not trying to get paid. I'm not trying to get sympathy. I just want empathy. And it's a difference between sympathy and empathy. Empathy is to endure with someone, put yourself in that person's shoes and understand what they're going through. That's all I want. And then I want also to help others that's in this. I'm in stage 4. There's no turning back. There's nothing to help me. No meds, no nothing. Just things to keep me comfortable at this point. Like I said, last year, a year ago, I was in in the hospice, but I went into a coma, and when I got out, my paperwork and stuff was messed up, so I never signed back up with the clinic I was going through because a lot of stuff was happening. So I just decided to deal with it on my own and with my doctors. I felt like I didn't need to go back on that because it's a lot of rules and a lot of stipulations, and also I didn't want to get on a lot of meds and stuff that keeps you like, you know, like zombie type shit. I just wanted to be comfortable, you know. At this point, I don't think that will help me to be out of it. You know, I want to live my life aware, joking like I do, you know. I don't want to get pumped full of meds to be like, you know, just out of it and not knowing what's going on. Anyway, let's get to this. I have a bunch of stuff on my table. Things that you have to get used to for the rest of your life if you have HS or any other diseases, that deals with wounds or what have you. You know, like I said, I deal basically with HS, what I know about, because it's something I go through, and my mother went through it as well, rest her soul. I would like to first, okay, someone asked me the other day, and I'm looking over here because I took notes. One of my friends I talked to, I hadn't talked to in a while because she helped me at one point in time when I was in hospice, asked me, I'm sorry, y'all, this light is so bright. Do I ever forget about my demise coming closer than others? Which demise is, you know, the end of my life. No, I can't forget that I am in hospice state just because I'm not in hospice. I cannot forget that because I'm reminded of that every day. I know that I will be leaving here. People do leave before I do, don't get me wrong, but the stakes are higher for me than the normal person. And like I said, it's the Lord say so, but I do understand that I am on the verge of going. And no, I can't forget. Every blood spill, every infection, everything is scary. There was no way. When I went into the coma, they didn't think that I would come out of that coma. I was in that coma for a month, and they did not think I was going to make it. And one day, I just woke up out that coma. Had a lot of things to deal with when I woke up. I had to learn how to talk. I had to learn how to walk, to eat again. I had to learn how to do everything again, to think again. I had to learn how to text again. I had to learn how to read everything right again. You know, I had to learn how to sing again. Stuff had to come to me. And it's amazing. I can't even explain it. Like even therapy, this and that. When I came home, I still didn't know how to walk. I didn't know how to walk. Actually, they did just dump me off in my hospital bed because I was not going to stay in a nursing home that wasn't really helping me do the things that I needed. So I came home and got therapy, and I started walking maybe like a month later, I started walking. And it was hard. Oh, it was hard to learn how to get up, sit down, all of that. It's hard. And another thing, okay, I'm trying to, how do I deal with knowing that things are only going to get worse? That's another question I'm asked. How do I deal with that? I don't. I let things come as they will. I don't. I mean, I know things are going to get worse. That's how this disease works. I can't say that things are going to get better. So when people are like, oh, it's going to get better, people tell you that because they don't want to talk about it. That's why other people say that. Like, it's some people I don't talk to because every time I talk to them and they ask me questions about things, they cut you off and say, oh, things are going to get better. Don't worry about that. It's going to get better. Stop telling people that and listen. You have to listen to people's problems. I know it's not going to get better. I'm not that stupid. How the hell can it get better? I can't get any surgeries. I'm not a candidate for surgery anymore because I got diagnosed with a heart condition, and I'm not a candidate for surgery or anything. So I'm on the verge of leaving here. So how could you tell me it's going to get better? It's only going to get worse. But you have to deal with it. I have accepted that. So people shouldn't sugarcoat things. I don't. That's why a lot of people can't talk to me because I don't sugarcoat things. That's just me. I'm very blunt. And this disease has made me very blunt, you know. Another thing, the supplies. I'm sorry, y'all. This light is making me... The supplies and my meds. I have oh Lord, I forgot my meds and things. Okay, I'll just go over some of what you have. Forgot my... Hold on. Hey y'all, I'm back. I forgot exactly where I stopped at, but I had to get my paper work because I don't want to mislead nobody. But first of all, oh my God, that light, y'all just don't know that motherfucker. Know it be shining, boy. Woo, that light. Anyways, I went and got my papers from the last time I was in the doctor. I got discharged August 28th, 2017. A few months back. So let me make sure. I have to make sure. I have to show y'all that. Hold on, y'all. Just trying to get stuff together here. I don't want to mislead nobody. Like I see it. I don't want to mislead you. Y'all know I make a song about any goddamn thing. I can't help it. I can't help it. It's got all my medicines and stuff. And like I said, I'm going to let y'all know about, I'm throwing stuff, fuck it, we'll clean it up when I get through. When I get through, we'll clean it up. First off, okay, this is my discharge papers. And I just want to go, like I said, I want to show y'all how it is dealing with the everyday life of me, period. This is not just when I'm in the hospital. This is every day. This is just when I get serious infections. I have to be admitted into the hospital because I can get septic. And I have been septic one time before. So we have to be careful because everybody knows with sepsis syndrome, you can die. And it's very serious to get septic. It's very serious, and it's very easy to get septic. Like it's a blessing that I'm here because people can fall down and get hurt and get a scratch and get septic and die. I didn't seen it happen in kids or anything. You know, somebody just think they got a simple wound, they'll go to sleep and they end up getting septic and don't know. You know what I'm saying? Somebody with an abscess or. You know, a lot of people with abscesses have got amputations and, you know, with a tooth or something, you can get septic and die, anything. So it's a blessing that I lived really all my life with wounds like this. And the critical wounds, like over, 20 years I've been living like this. And they still can't believe that I'm still here. I almost was gone a few times, but I'm still here. And everybody know, well, I don't know, cellulitis is like infections of the skin fold. So you'll see that word a lot used in people with HS cellulitis because a lot of people don't have education in HS, hidradenitis suppurativa, the disease that I suffer from, the skin condition. A lot of people are not educated in that, so they'll use the term cellulitis. It is cellulitis that you get from that, but the disease is an ongoing thing, so it's not totally just cellulitis. You know, you have infections of these cysts that you develop. HS is it creates sinus tracts under your skin, so it's not just the little cysts that you see. It's in your system, period, and you have flare-ups from time to time. I'm past the flare-up stage, so what I have now, I'm in stage 4. Comes in 4 stages, you know, so whatever. Back to my discharge instructions, and to let you know this is me, I'm going to show you. I'm going to have to hide my business, of course, but I just want to let you know that this is my discharge summary, nobody else's, okay? Okay, let me show you. We'll cover it up somehow. Okay, baby, come on. Hold on. Hold on, we can't let them see. We can't let them see. I love y'all, sweet babies, but you gotta be careful. Here we go, right here. Hold on, don't show the account number. You see the patient name right there? Patient name. Carlahorde. There you go. That's my discharge summary. Okay. Now, first of all, what we'll talk about, I gotta let this flash go out my eye, is the reason for my hospitalization was infection, complex cellulitis, which is infection. My diabetes is well controlled at home, and I was sent home to go on a regular regimen as I've been doing because my diabetes stays well controlled. Obesity, of course. Hypertension, of course, is stable. Is usually stable unless it gets low or high. I have the blood pressure that goes real low at times, and then when sometimes it get out of whack and go high, but usually it gets low. Gastric bypass surgery, I'll explain that to you guys. I also have the surgeries that I got from the hidradenitis in multiple areas. Hidradenitis suppurativa, which I'm talking about. Type 2 diabetes, which I just said. I don't know why they got it twice, but okay. Severe tricuspid regurgitation, which is the heart disorder that I have. And it went from mild to severe within a year. That's a leaky valve of the tricuspid valve. So that's what that is. And it became from mild to severe within a year. And there's nothing they can do for that. I'm not a candidate for surgery of any type. So The only thing they can do for that is just medication, which is a water pill, and I'm already on that. I'm on that for other things like my tumors and things. So there's really nothing they can do for tricuspid regurgitation. I feel palpitations all day. I have heart arrhythmia also. And I'm feeling my chest flutter all day. You know, I don't have any other heart disease. Like my sister died of cardiomyopathy. And my dad had congestive heart failure before he passed away. But other than that, I don't have those heart diseases, which I'm blessed not to have those. But I do have a heart disorder, the tricuspid valve. My vital signs when they release me, this is the norm that I usually run. My temperature is 97. Usually it runs on the low side unless sometimes like when you keep recurrent infections, it runs low until you have a serious, fever, infection of some sort. Then your fever gets high. But anyway, it was 97. My pulse was 80. My respiratory was 18. My blood pressure was 129/72, and my pulse ox was 96. And my head was normal, which is atraumatic. It was normal. My eyes were normal, you know what I'm saying? Mucous membranes, moist, which is normal. Routine neck exam, supple, trachea midline, normal. All of that was okay. My lungs were clear. My trachea midline, like I said, were okay. Cardiovascular exam, I told you about the tricuspid. And my left side is weak. My left side of my heart is weak from high blood pressure medications or whatever you have you. My skin was dry yet warm. My HS with multiple masses, which means the tumors I have, the biggest tumor I have is the size of a watermelon. It's about like that, the size of a watermelon. And I have like about 3 to 4 of them, and the doctor saying they weigh between 80 to 100 pounds altogether. So I'm carrying that weight around. And if you see me sitting crooked a lot, it's because I have one of those tumors on the back of my thigh, the one that's the size of a watermelon, and it sits up in the chair, and I have to sit crooked. I have to sit crooked because I can't sit on it. When I do, it's so painful. That's why I'm sitting crooked. So you ever see me sitting crooked during a mukbang, anything, that's why I sit crooked, is because of that. And I'm not able to sit in regular chairs, just my lift chair at home and my wheelchair. It hurts when I sit in my wheelchair, but I deal with it for the little time I'm out. But other than that, I can't sit in regular chairs, couches, any of that. I have to sit in my lift chair, which, I'm thankful for. They gave me, I got a lift chair, I have a wheelchair, I have a walker, I have a bath chair. I have all of that at home to accommodate me. Let me see. Okay, now we will get to my medications. That's what we'll do. We'll get to the medications. All this other shit, I don't think y'all care about all my yada, 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 all my little, I got everything. I get copies of everything now. Like you have to, when you're discharged, you have to go over everything. I get all my results of all my tests and everything. But anyway, we're going to go over my meds. This is my med bed. I use my old Coach purse, full of meds. See all them meds? All of them are mine. Meds. A whole big bag of meds. Let's go over the meds. The meds I use are, oh Lord, I'm going to try. A Buterol inhaler. I have bronchial asthma. Basically, it acts up sometimes. I have to use it. Sometimes I don't, just when it cuts up. Amlodipine, I use 2 of those at night. That's for my blood pressure. Atenolol is for my palpitations and blood pressure. I take 1 of those at night. Buspirone is for anxiety. I take those at night. Also, the antibiotics I take doxycycline. I take that twice a day. Antibiotics for my HS. I have to take that every day for the rest of my life. Dicyclamine, I take up to 4 of those a day for my irritable bowel syndrome. Yeah, I have IBS also. Also, I take furosemide, that's a water pill, Lasix, 40 milligrams once a day. Gabapentin, I take 3 of those per day. That's for my, neuropathy. I have neuropathy also I got from my diabetes. I have neuropathy, and I also have fibromyalgia. So I take that for both of those. And I take, Imodium, I take that for my, for the IBS. That's not, that's over the counter, but they had that down too. I take metformin, which is for my diabetes. I take 2 of those a day. They're pills. I take morphine, 2 of the 60 extended capsules every day. I take naproxen as needed, 500 milligrams twice a day. But I'm not on that right now because I only take that being that I had gastric bypass. You can't take NSAIDs for a long time, so you're not really supposed to take them. They don't want you to take them at all, but the doctor can put you on them in a short amount of time. So I take it probably 3 times out of the year or twice a year to help with my neuropathy and things, inflammation. Also, I take, excuse me, y'all. Oh, Lord. Nystatin is the cream and the powder. I take the Nystatin cream and the powder for my wounds and everything. And I also take, oh my Lord, I can't see, ondansetron, which is Zofran. I take that for nausea, and I take those every 6 hours as needed for nausea. And believe me, I need it all the time. Oxycodone, acetaminophen, 10/325, which is the Percocet. And I take those every 6 hours. I take 2 of them every 6 hours. The Silvadene cream. Silvadene cream is for also for the wounds of the HS. Like I said, I'm on a lot of things for that. I thought I brought my jar in here to show you, but I don't think I brought it. Tramadol is another pain med, 50 milligrams every 4 hours for pain. I don't use that all the time, but I'm using that right now because I like to put that to the side for back pain and everything. Now, I'm usually on the Percocet and, the morphine most of the time. Trazodone at night for sleep. I take 250 milligrams, so that's 100 milligrams at night. 2 venlafaxine, the antidepressant drug, because being that the situation I am, you're going to be depressed, with all the deaths in my family and all of, the death becoming me, you know what I'm saying? You need to be on something. And I don't know if I said it, but Protonics for my acid reflux. I have that. So that's the medication. So I'm gonna show you some of the things that you have to get used to what I have to get used to for the rest of my life, and I have already. Like I said, I meant to bring the jar of Silvadene cream and other creams in here, but I didn't. I thought I was ready, but anyway, you're gonna have to deal with wipes. You're gonna need those. You're gonna need wipes. You're gonna need Dial soap for bathing and any other kind of washing up or that you do when you go to the restroom. You're gonna need these bed pads that from the hospital. You know that they lay on the bed. You're gonna need those. This is what I have to deal with. You're gonna be using. I use the 4x4 gauzes. 4x4s. ABDs, you use 5x9s and 8x10s. This is the 5x9s ABDs. ABD pads. Anybody that had a cesarean section, they know what an ABD pad is. But you use those for drainage of the wounds. You have to use the Skin Safe calcium alginate dressing. You have to use that. That turns into a gel form. It lays on the wound, and it's really good. It absorbs all the drainage, and it turns into a gel so it can lift away from your wound, so it won't saturate your wound. And also, you'll be dealing with this Safe Cleanse. I know you've seen that at the hospital. It's for wound care, cleaning of your wounds to clean away the debris. And you're gonna need these. We wear gloves for everything, cooking, everything you can name. We use it for when I change my wounds, when I go to the restroom, everything I use gloves for, everything. And I have an OCD with washing my hands. I use antibacterial soap for that too. This right here is something I found online. I love it. And like I say, I do a lot of shopping online because I can't get out like that. If I don't send my kids, I'm online. This is really good to clean your toilets, bathroom, everything. You have to make sure you sanitize everything when you're done to protect yourself and to protect other people. And this is something I buy. I buy the Members Marks or the Lysol wipes. I don't like Clorox because that's that bleach. That bleach can get strong and you can't use it on everything. So I buy these Member Marks from Sam's Club or either on Amazon or off Jet.com. I love Jet.com. Okay? This is just the wipes to wipe away bacteria. Everything antibacterial that I buy. So that's going to be the conclusion today. I'm going to do an update another day because I got other meds and stuff. The creams and stuff I need to show y'all, you know. Those that are interested in my sickness and everything. And like I said before, I want to explain to y'all what I mean when I leave in the P.O. box and the email. Because like last year, I came up missing to people that will support me in this HS awareness. I just stopped. I wasn't on Facebook anymore. I wasn't on any social media anymore. I wasn't posting anymore. They didn't hear from Carla at all. And you know why? Because I slipped into a coma and nobody knew it. So I was missing for months and months and months. I was sick due to that coma. And when I came home, I wasn't on any social media. So a lot of people did not know. I had so many messages in my inbox when I did go back on Facebook. Because like I said, I had to learn how to talk, walk, write again. I'm still having a hard time with writing. I write so sloppy anyway. So when I write now, I hate writing because it fatigues me. I don't know, but it does. But I'm much better now. But yes, it does fatigue me when I write. I don't like writing. I'd rather type than write. But I didn't know how to type or anything. But like I said, I came up missing. And you never know what's going to happen. So that's why I like to leave my P.O. box and email for anybody that want to contact me. Because my kids will have control over all of that. So if I ever come up missing, leave messages, anything, my daughter or my niece, they will contact you. Most likely my daughter will contact you and let you know what's going on. So I will leave my P.O. box and my email address in the description box, most definitely. And like I said, you have my Facebook, you can add me, anything. Facebook usually tells everything because like a lot of people post everything, but when that happened, a lot of people didn't know a lot of things because my kids was not on social media like that because they were dealing with me. Because like I said, they didn't think I was going to wake up out of that coma and a lot of stuff was happening. So on my Facebook, you'll see a lot of people saying things. So that's another way you could tell when things happen to me, when people are on there saying things. So it's really good to stay in contact with people that you care about on Facebook, on mine anyway, because like I said, I'm open because I also have a like page. That's another page. Be sure to go like my page, Living Life Purple, on FB, which will be in the description box also, or at the end of this video. Living Life Purple. That's my personal like page. Me and my daughter are the administrators of that page. So if you got anything. What the fuck? That's 30 minutes. Huh? Go ahead. Go back. Save it. Go ahead. Did you save it? Oh, it's back. It's still on? I'm sorry, y'all. I thought it was messed up. I guess we'll edit that. If not, y'all understand shit happens. But anyway, if you got anything to say, go to Living Life Purple and say it on there or send a message on there. My daughter will get it for sure because she's the administrator on that. And also, that will update you on my medical things. So, thank you guys for coming. And thank you for caring about me so much to even click on this. I love you guys. Like I said, as long as I'm here, I'm going to try to put out the videos. If I got to lay in my bed and come out with this right here, I am. The other stuff is for fun, but this right here is real. And this is what I go through every single day. This is just a part of it. Just a part of it. This is just the medication part of it. But the other parts will come to you later. Like I said, keep watching the videos. And like I said, go check out the dude, YouTube channels, the cutest, J Cutest, and cutest vlogs. It would be somewhere on the screen. Like I said, I don't know where my daughter's going to put it. Wherever. And at the end of the video somewhere. But J cutest and cutest vlogs. I think I'm pronouncing it right, but you'll see it. Just go check that out. And I love you, sweet babies. And whoever, if you're not a sweet baby, hit that subscribe button and become a sweet baby today. And like and comment as you please. Love you guys. Peace.